Well, I love coming to this summit. This is the second year that I've been here, and I think one of the things that I see more than I see in other places is just the attendance that you get. I think you've got well over 300 folks this year, and all interested, and you can just tell because they're not getting up and leaving the speakers as they're talking. They're really focused on the material.
There's so many people from so many different parts of the system. And you really get a feel for how many moving parts there are, and really where there can be inefficiencies or problems with communication.
I think it is good, again, because of the broad curriculum. It pulls from the hospitals, from area agencies, from skilled agencies, nursing homes, and it's really, we found with the Care Transitions starting up is that getting everybody to the table to talk about the issues is one of the biggest things, and that's where everybody benefits the most. So shared practices, what's working, what's not working. I think that by having these gatherings, you see all that.
The word itself, Care Transitions, really speaks to the fact that this has to be a team effort, and not just a team where you are producing those services. So if you're a hospital team, you need to be just as aware of your community-based team, of your home health, of your physician organizations, and so those team processes are where we can see the successes and really move forward.
One of the things that impresses me most about the Care Transitions program is the scope of it. Prior to joining the agency, I was working in the My Choice Waiver program. I was aware of the Care Transitions program. However, not until joining the Senior Alliance was I able to see just how broad it is and how many people are involved. It's not just coaches, it's not just the AAAs, but it involves the hospitals, the home care agencies, the hospices, everybody that's part of the care continuum.
But the work that was done with polypharmacy, looking at long-term care patients and the number of drugs they're on and reducing the number of drugs that they're on, that is fantastic work. I mean, it's really great work. But then you hear that patients who are in the hospitals, so there's that transition there, transition of care, don't have that same level of attention paid to the amount of drugs, the med reconciliation, the amount of drugs, redundant drugs, maybe reducing drugs. So it would be nice to see movement in that area.
Even reaching out to third-party payers, additional entities that we can work with to continue this care transition on for, I mean, it's not an issue that's ever going to go away. So I see the value in it, I see the benefit for the patients, and I think that we're finally getting on the right track as a community.
I think it's really important to bring everybody together as part of our collaborative. The CCTP at Southeast Michigan is one of the strongest collaboratives in the country. It's something that everybody who's part of it is very proud of. Recently, as a recipient of the Governor's Award of Excellence, we've demonstrated that what we've built is a coalition of people that are willing and committed and taking time out of their busy schedules to work toward the common goal of reducing rehospitalizations.
I think it's important that you come as a team, and I think it's important that you extend your hand across the aisle to the next team that's out there, because you're all working with the same patients, and it's really important that you're able to do that.